This how to use video is for the HIV, Herpes 1 and 2, Hepatitis B and C, and Syphilis rapid blood tests. The components of your test kit are in a resealable bag contained within an unmarked envelope. Remove the bag from the envelope. Unpack the contents from the bag. It contains the following items: the applicable test cartridges, a pipette with buffer solution, cotton wool, an alcohol swab, a blood lancet, and an instruction manual. There is a sealed pipette containing buffer solution. Please ensure that there has not been any leakage of buffer and that the pipette is intact. A piece of cotton wool, an alcohol swab to clean your finger before performing the test, a single-use safety lancet to obtain a finger prick blood sample, the appropriately marked test cartridges. The smaller round window is where the blood sample and buffer are placed. The larger oval window is where you will read the test result. Open the cartridge packets and lay the cartridges out in preparation for the test. You will need to use your own timer and a pair of scissors. The first step is to obtain a blood sample using the single-use lancet. All tests must be performed at the same time so that you don't need to prick yourself multiple times. Do not worry, to most people it feels like an elastic band snapping against your finger. It is not painful. Open the alcohol swab and clean the tip of the ring finger on the side closest to the little finger. Ensure that the alcohol dries before continuing. Next, pick up the safety lancet and remove the cap. While squeezing your finger, place the white end of the lancet against the cleaned fingertip. Push the lancet firmly against your fingertip until a click is heard. Once the prick has been made, squeeze 2 drops of blood onto the small window of the first test cartridge. Note that the test may be performed in any sequence. Then dab the cotton wool against your fingertip to remove any dried blood. Then proceed to squeeze 2 more drops of blood onto the small window of the second test cartridge if you are performing more than one test. The second step is to add the buffer solution to the blood sample. Pick up the sealed pipette containing the buffer solution. Ensure that all the buffer solution is away from the tip and then proceed to cut off the tip with a pair of scissors. Then squeeze 2 drops of buffer solution onto each of the test cartridges at the small window containing the blood sample. Set a timer and wait 15 minutes before interpreting the test results. Do not interpret your results before 15 minutes or after 20 minutes, as this may give false results. After at least 15 minutes has passed, proceed to read the result. First, make sure that there is a C line. This line confirms that the test worked. If there is no C line, do not proceed any further. The test was invalid. If there is a C line but there is no T line, this indicates a negative test result. If there is a C line and a T line, this indicates a positive test result. You need to look very carefully because even a faint T line indicates a positive test result. Please remember that these rapid tests are purely for screening purposes only. Any positive results need to be confirmed by further testing. Always seek further help at your nearest clinic or general practitioner. Any negative test should be repeated in 6 weeks. Once you have completed the test and read your results, place all the test component items in the plastic bag and dispose of it safely in a bin.